can start. Okay. So the first session will be about an overview of what research is, what are the steps of research, and then we will go over the first step, which is phrasing the research question or coming up with a research hypothesis. Okay? As a learning objectives of this session would be, and actually of all the series, is to help you design your own research and hopefully make you able to read the literature critically, analyze and summarize your data, and succeed later in the future to publish your results. Okay, so who can tell me what is research in your mind? Doctora, what is research?
It's when you have a question about a medication or any other disease to which you need an answer.
Okay.
When you compare it to another disease, for example, or when you compare a drug to another one or to a placebo.
So what you're describing is actually the process rather. What is the definition of research? Ms. Reen?
Research.
What do we do when we are doing research? We are investigating something, okay? And how do we investigate a certain question, for example?
By trying to search for answers by different methods.
Yes, so you have a systematic way of doing it. So basically, a research is defined as a process in which you are seeking knowledge to know more, to search for new knowledge by conducting a systematic investigation, ultimately with an outcome that you hope to reach at the end of this process, which is you may want to come up with a new discovery, you may want to establish new facts or prove new theories. And all of this process requires that an investigator has an open, inquisitive mind, because it all starts, as Doctora said here, with a question to which you need an answer. And usually questions come only when you start, digging around for more information. Why is this happening? How did it happen? What were the reasons? What should I do, etc., etc. So you need to have an inquisitive mind. Research definition or the research process per se is not something new. It has been ongoing for a long, long time, maybe before, before prehistoric periods. And many people have defined it in different ways, but it all comes back to the same thing. And I want you here to just notice the words that come with almost all definitions. It's gathering of data, any gathering of data, information, and facts for the advancement of knowledge. Another investigator defines this as a process of steps used to collect and analyze information to increase our understanding of a topic or issue. Why is it important? Why do we need research?
To update our knowledge about
Okay.
For answers.
we need evidence.
For? Yeah, so sometimes the answer is there. What do you need research for?
To discover new.
Yes, it's basically to add to the knowledge. Something, you're trying to address knowledge gaps in whatever area of research interest you have. And all of this serves the purpose of advancement of knowledge. Okay, so it's basically to advance your knowledge. And in order to do this, there is a process that requires certain steps. The first and most essential step is to identify a research question. So that's the most important step and the most difficult, actually. And I'm sure many of you have struggled when you were asked to come up with a research proposal. The thing that you struggled most is, what am I supposed to search for? What is my research interest? what is my question? What should I be looking for? Because at your level, you probably did not have enough encounters to have enough, questions in your mind to go and search for. And therefore, once the question, the research question or the research problem is clear in your mind, the rest is easy job, okay? So identification of the research problem, this requires that you sometimes come up with a research hypothesis, but you should always be able to state explicitly your research question. It has to be very clear in your mind, what is your question? The second step after you state or identify your research question is to go and find out, what does the literature say about this question? Are there any knowledge gaps in this area? What has been done? What needs to be added to the literature? So you conduct a thorough literature review revolving around the area of interest, the purpose of which is not only to summarize the literature, is to summarize and find the knowledge gap, because this knowledge gap is going to be your target of research. Otherwise, your research will not be original. If you're trying to research something that is already known, you're wasting your time, you're wasting money on that, and it is really unnecessary, and you will have a hard time publishing. People do not publish known facts. People go after the new knowledge. So the trick here is try to identify the knowledge gap regarding the research topic. The third step, you sit down after you've done this and specify the purpose of the research, often referred to as the objective of the study, okay? Once you've done this, you start putting together your methods of data collection, and that includes your study design, who are the participants, if you need a control, who should be your control, what type of intervention you are planning, how do you want to assess your outcome, how do you want to analyze and interpret your data, etc., etc. And ultimately, the final step in this would be to report or disseminate your findings through publishing, okay? And therefore, now you are disseminating the knowledge that you have gathered and you have added to the literature. All this requires a method that you may read about or hear about often, which is called the scientific method. And the scientific method depends on the following points. Observations, so you observe something from which you generate a hypothesis. Okay, and then sometimes you read in papers the null hypothesis versus the alternate hypothesis. I'm not going to even to talk about this. Some of you may have had some statistics courses where you could have an idea about what constitutes a null versus alternate. For example, I want to prove that the new drug, the new antihypertensive, is more effective than the old hypertensive, okay, hypertensive treatment. Let's say drug A versus drug B. So my null hypothesis would be that drug A is equal to drug B in effectiveness or efficacy. My alternate hypothesis is that they are not equal. One of them will be stronger or more effective than the other, okay? It's usually the opposite. And this is often required when you're trying to put together your sample size. And at your level, you don't need to be that familiar with it. You need to be familiar, but you don't need to have full expertise in how to design your sample size. But you need to consult a statistician or an epidemiologist to help you put together a decent sample size, okay? After you've identified your hypothesis, the next step is you design your study, you design the investigation, and then you go to conducting the study, which is testing your hypothesis, and finally you come up with your conclusion, which will either accept or refute your null hypothesis. Will either show that yes, both drugs are similar, or no, one of the drugs is better than the other, okay? Now, you do the study, so you find some conclusions. Would this be enough? Is it a solid knowledge that you have produced? No, because always new knowledge needs replication. And this is what we mean by more people replicating your findings, يعني establishing that your findings actually represent the truth and are not biased conclusions. For example, this investigator Randolph Rummel said this nice quote: "No researcher should accept any one or two tests as definitive. It is only when a range of tests are consistent over many kinds of data, researchers, and methods that one can have confidence in the results." So one experiment is not enough. You have to do more experiments, maybe in different settings, different participants, etc., always going in the same direction in order to be confident of your findings. I would like here to make a distinction between what constitutes primary research versus secondary research. When we say primary research, we are referring to original studies, that is, studies that are conducted on, now we're in the medical science, let's say human beings, testing drugs, testing different interventions, different diagnostic methods, etc. Whereas secondary publications or secondary studies, in those studies, like in systematic reviews, you've probably heard about systematic reviews and meta-analysis, or evidence summaries, or commentaries, or reviews in general. All of these are not primary original research. They are referred to as secondary studies or secondary publications because they are reporting the findings of existing research, the findings of other studies, usually original studies. Okay, so you would like to know what if you come across, for example, a systematic review on corticosteroids in asthma. Okay, it is going to be talking about different studies done by different investigators in which the participants had asthma and on whom they used corticosteroids. So it combines them together. Okay, there are good reviews, bad reviews, meta-analysis only, systematic reviews with or without meta-analysis. All of these are referred to as secondary publications. This does not mean that they are bad, not all. Yeah, not at all. يعني مش البرايمري دايما أحسن من السكندري. But it is important to know what is the difference between the primary and secondary. Also, the research methods may vary. In the medical field, there are two types of research methods that you can use. You can either do a quantitative investigation, which, in which you measure your outcomes using numbers, usually numerical data. You use statistical analysis. You are talking about sample size, etc. So it's all about quantitative properties. Most of the studies that we use in the medical literature are quantitative studies. On the other hand, there is also the qualitative method, in which you do not use numbers. Actually, you're talking more about human behavior, experiences, etc., perceptions, attitudes. All of this, you cannot measure those using numbers. And people use qualitative methods in order to explore and understand those qualities or behaviors, etc., and the reasons why people behave in a certain way. Most often, the methods used in qualitative research include either observations, like if you've seen National Geographic films, where an investigator would, observe, for example, tigers in a field. He will just sit aside and take pictures and observe their behavior and then transcribe everything that he saw and try to come up with conclusions from that. So observations could be one method. The other method is referred to as interviews, one-to-one interview. And the third is focus group discussions, where you gather a group of people and you start asking them open-ended questions and they share ideas. And all of this, ultimately, you transcribe all the interviews and you try to come up with what we refer to as themes. يعني ideas that share the same thing. For example, they are all talking about the positive feelings they had after this workshop, or the barriers they faced during breastfeeding. Okay, so for example, every participant would say, well, one of the barriers was that I was sleep deprived. The other one would say, I could not take care of my home, for example. The third one said it interfered with my social life. So all of these come under barriers, the common theme. The others are minor themes. So this is how people do with qualitative research. I'm just introducing this because now it's something very, very خلينا نقول على mode in research, where people combine both quantitative and qualitative aspects. Before we go to the research question, let me just go quickly and briefly over what is the anatomy of a research article. This is often referred to as the IMRAD format, and it's an abbreviation, I for introduction, M for methods, etc. A research paper is typically composed of a title, authors and their affiliations, where do they come from, what are their institutions, their backgrounds, and then you have a section referred to as the abstract, which has a sentence from each section of the article, a sentence about the objective, methods, results, conclusion. Now the abstract is just a very, very, very brief summary of what is this article about. People use the abstract to just give you an idea for the reader in order to know whether this is inviting for you to read more. Should you go after the full paper, or this is not what you are looking for. It's also used for indexing in journals and databases. It is not the place that you should go when you are doing an assessment of the article itself, when you are putting together a literature review. You should actually read the whole paper. But it's like the ID you wear. It tells me what is your name, who are you, what is the institution, what level, Mat 3, Mat 4, resident, etc., in which department. But it doesn't tell me, are you a competent physician or not, what are your likes and dislikes, etc. So it's just for the purpose of indexing. The main the main sections of the paper are the introduction, methods, results, and discussion. So in the introduction, the investigator would be telling you why was the study done. Okay? This is the place where the investigator should summarize for you the literature around the question of interest. And the introduction should specifically and explicitly state the research question that the investigators are trying to address. And also it should highlight the knowledge gap in the literature. And it should state what do they want to do in order to address the knowledge gap, okay, in that particular study. The next section is the methods, and in the methods they describe how the study was done and how were the data analyzed. In the results section, the authors would state what did they find in terms of results. And finally, in the discussion, the authors are telling us what do they think their results mean. Not necessarily that the results represent exactly what they think it means. Sometimes their conclusion may be wrong. Okay? So it doesn't mean that necessarily this is the right conclusion for you to make. It's telling you what they think their results mean. You may or may not agree to that. Okay, so we are done with the first part of this session, which is an overview of what research is and the steps involved. Any questions so far? Okay, so we said that the first step in putting together a research project is the research question. And we are going to discuss the following. I define what is a research question, where do you get, what are some sources of research questions, what are the finer criteria for good research questions, and then the elements of a research question. How do you define and refine your research question? And then some common problems that we see with research questions and the solutions to those problems. And then we'll go over 2 or 3 examples of research questions. So what is a research question? It's basically a question that is talking about an uncertainty in knowledge that you are trying to resolve. Most often your question should be in an area of interest to you. It is useless if you're just doing it for the purpose of producing something because it's a must for the research fellowship, residency and fellowship program. You're not going to enjoy it. Actually, if you're doing it with passion, because this is, you know, the thing that you like, it is a really very, very, very nice thing to do. Many people, you hear about people that quit clinical practice for research. Our dean is an example, and he was a brilliant student. It's because research is so much, you know, it feels much nicer than clinical practice. So this is my advice to you when you go to your mentors. Try to choose mentors with common research interest with you, because then the experience is really outstanding. A research question represents the foundation of the study, and you have to spend time thinking about it before you embark on anything, okay? And in order to do this, you have to phrase your question in terms of objectives or hypotheses. So I think that drug A is better than A. My objective is to prove that drug A is better than B in which participants, okay? In comparison to what? When should I be assessing this? So all of this will follow as soon as you have defined your question. And I will give you some tips on how to do this. We keep saying this always to investigators. If you start with a confused question, you will end up with a confused study. As they say in research, garbage in, garbage out. So it has to be a very clear, good research question from the beginning. If you are reading an article, you finish the introduction section and you can't guess what is the question that the study is addressing, automatically your conclusion should be this is a bad study. I shouldn't be wasting my time reading it. If it is not clear to you, it's not clear to the investigator himself. So this is a bad study from the beginning. So how do we come up with research questions? As clinicians, lots of time from our patients. Many patients ask us questions that we don't know the answer to, so we go, we search, we try to find out an answer, and if you are lucky, you find that people have struggled around this area, around this question, and boom, it's a knowledge gap. If it is of interest to you, you go and you design a study that addresses this knowledge gap. Literature review. Many times you're doing a literature review and you find from the review that research gaps exist in the following areas, and they state for you what more studies are needed in this field. If any of you read any Cochrane review, many times in the conclusion they will tell you about the knowledge gaps that are still existing. So again, people can actually address those. Only recently, last year I think, and I'm talking from pediatrics, do you get evidence updates? Anybody gets evidence updates? Okay, so I received one of those evidence updates about a Cochrane review, which was talking about non-lactose milk use in acute gastroenteritis. And in the review, in the conclusion, they said that there are no studies from developing countries, and that all the studies come from developed, and they were about inpatients. So it's not applicable to everyday practice, because many children we see with diarrhea, with acute gastroenteritis, we see them in clinics or in OPD or in ED. So it's outpatients. So clearly they have identified the need for studies in that setting. And therefore, the next step is we jumped on this opportunity. We put together a research protocol, and we invited one of our residents who is now a fellow in cardiology, and we produced a protocol. We actually applied to the MPP funding agent تبع institution, and guess what? We were ranked very, 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 very high. It's a very simple study, and we ranked very high. We got the IRB approval. We got everything. We're starting next week. And we published the protocol in clinicaltrials.gov already. So it just, you know, from a simple evidence update alert by email, now we're going to a real study. Sometimes you get ideas from your previous research. So you've published something and you found that one of your secondary outcomes was significant. So this is something that you can explore further with another study that addresses the secondary outcome you discovered as a primary outcome this time. Also, your mentors will give you lots of ideas because they come across so many things, and then they will come after you and say, hey, I have this idea. Are you interested in working on this? So again, this is a good resource to tap. Lots of times, conferences, journal clubs, you will hear a lot of questions asked from your colleagues, from your attendings, etc., that need to be explored further. So keep track of those things. You never know. You can find something very interesting. What are the finer criteria for research questions? So in general, we say a good research question is a question that is feasible to do, interesting to the audience of the relevant audience. Like if you're in pediatrics, you would like to publish something interesting for pediatricians. It should be novel, not something that is already known. It should be ethical, and it should be relevant to many stakeholders like patients, society at large, clinical practice, social, political. It can address social or political concerns, etc. So these are the finer criteria, FINER, okay? And I think you should take note of this, because as you are putting together your study, you have to think of them. Feasibility means look at your sample size. Is it very huge? You cannot really, in a reasonable time, collect this number. Is it difficult to recruit this type of participants? Do you have among your team the expertise necessary to conduct such a study? Can you afford it? Do you have enough funds? Okay. Is it manageable? Sometimes it is huge over many centers, etc., and you don't have enough personnel to go and cover the conduct of study in every single center, so it's not manageable for you. And if it is not manageable, you are going to be in trouble with the IRB at one point of time, because something will go wrong and they will stop you from continuing. Somebody will get harmed. Okay. What are the elements of a research question? And I think I should say clinical research question, because the basic sciences have different format of research questions. You may have heard about the PICO. The PICO is an abbreviation for P is for patients or population, I is for the intervention to be tested, C is for your comparison or control, and the O is the outcome, T is for the time of the outcome assessment, okay, PICO. If you're okay with the PICO, that's fine. The T will come later as you become more experienced. So a question is actually nothing but a combination, or if you want, it is in a mathematical equation where Q is equal to P plus I plus C plus O in one sentence, okay? P, as I said, refers to your patients. In the P, you have to describe your participants, your patients. What are their ages? Which gender are you talking about, males, females, or both? And what is the condition of interest that you want to research? In the intervention, you could be talking about a drug, you could be talking about a device, you could be talking about a diagnostic test. So this is the one that you are investigating. The comparison is the comparison to the intervention. So if you're talking a drug, it could be a drug, an active drug versus a placebo, or a drug versus another drug. If you're talking about a diagnostic test, it is a test against the reference standard used to diagnose this condition. Okay? And so on and so forth. The outcome is, what are you going to measure as a result of this intervention? So what do you expect this intervention to do in the patient? Okay? And the time, when do you expect this outcome to happen? Like if I'm going to give you an example. Let's say I'm interested, you are all above students because sometimes I use this as an OSCE case for the students بالquiz تبعهم. So let's say I am interested, actually this is a true question that I struggled with many years ago until I went and searched. And there was already an answer to this question, so we didn't do anything about it. But for the pediatricians or family physicians among you, you often have patients where you test them routinely with PPD test. And many times you may hear different instructions given to parents. Some would tell the mom, look at it after 2 days. If it's not, red, bulging, etc., you don't have to come back. Next time you tell me whether it is positive or negative. Some would ask the patient to come back 48 or 72 hours later for the health professional himself or herself to check it. So which one is more accurate? Is it okay to depend on the parent? Do they miss? Do they diagnose a positive PPD test correctly or not? Well, in order to search this, you have to phrase this PICO, because the PICO will help you put a good search strategy together. So in this particular instance, I'm interested in finding the accuracy of parental interpretation of PPD as opposed to a healthcare professional interpretation. My patient would be a child tested with PPD. The intervention is parental reading of PPD and comparison healthcare provider reading of PPD. And the outcome is sensitivity and specificity of the parental assessment. So if I want to phrase my question, I would say, what is the sensitivity and specificity of parental interpretation of PPD as compared to a doctor's interpretation or a nurse's interpretation? So this is my question. Very clear. It has all the segments of the PICO. Now, the importance is that it narrows down your question, because the moment you write it down, you start thinking, okay, I'm interested in شو بعرفني in cancer. Okay, so what cancer am I talking about? بلشنا نفكر, which cancer am I going to focus on? Is it in males, in females, in children, in adults? Even if you choose, sometimes you say acute lymphoblastic leukemia. All of them or a particular set? Is it at presentation or those who relapse after a certain regimen, etc., etc.? So automatically, just by thinking the P, you are starting to narrow down and focus, zooming in on your participants. It provides you with search terms and therefore saves time while you are searching, because you're going to pick up a search term from each one of the PICO elements, like the condition from the P, the intervention from the I. The comparison sometimes is if it is another test or another drug, مش placebo, you have to enter this in your strategy. The outcome, sometimes yes, sometimes no, depending. If your outcome is hard outcome like mortality, you need to enter mortality or death or disease, etc., or survival as a search term. Whereas if it is pain relief and you're talking acetaminophen versus placebo, you don't really need to enter pain relief as a search term. So that will help you save time. How many of you had any sessions in searching with Mrs. Farha? Did you? Okay, did you go over the PICO? You remember this? No? Okay, never mind. It identifies the appropriate study design, okay? Because If I find out that I'm talking about therapy, about drugs, then obviously I should do the best study design in order to be as free from bias as possible. If it's about therapy, I should design an RCT. If it's about a diagnostic test, I probably should be designing a cross-sectional study. If it's about the prognosis of particular condition, I should be designing a cohort study. If it's about a harm from something, I should be probably putting together a case control study. Like one of the questions we recently came across is, what is the association between autism and breastfeeding? So we're having an epidemic of autism, and at the same time, breastfeeding rates are going down. So are these two related? You know, autism in the brain, breastfeeding has been shown to give, you know, good IQs later up till the college time. So is there any association between the two? And therefore, this is a harm question. Do you think that you would recruit and randomize children to breastfeeding, no breastfeeding, and 20 years later or 10 years later see who developed autism? This is about harm. What you do is you start with children with autism, children who do not have autism, and you start asking the parents about their feeding when they were born for a particular duration of time. And this is a case control design. So once you start with the PICO, identify all the elements, the next thing is decide what study design I would like to have. And as we said, inclusion, exclusion criteria, the setting, من وين بدي جيبهم, inpatient, outpatient, should I go to the community, etc. The details of the intervention, as we stated before, the choice of the outcome, how do you want to collect your data, how and when to assess the outcome, and how do you want to analyze the data. You might at this stage think, how does just writing the PICO help me do all this? Once you start putting it on paper, it will just, you know, هي رح تعزمكم انه فكر بعد اكثر. How am I going to do this? Okay, so how do you define your research question? In general, you start with the problem, and then if you can consult experts who share, you know, who are experts in this field, get their advice, write it down, specify its PICO elements, and start narrowing it down so that it becomes searchable and measurable. And I'm going to give you some examples here. For example, and this actually from this question came so far 4 publications. 2 of them are original. 1 is already cited in the Cochrane review, and 2 of them are cited in a Cochrane review, and 1 of them is in BMJ, just from this simple question. And it only we came across this question from clinical encounters. Like, we used to round an emergency room, and different physicians would give different advices to the parents, and the parent would tell you, الحكيم قال لي استعمل الدواء اللي بالتم، واذا ما مشي الحال برجع بعطيه تحميله، بعطي هاي مره هاي لانه التحميله اقوى. Another one تقول لا انا ما بعطي تحميله لانه حكيم قال لي التحميله ما بتنفع. So different opinions. The next thing is we went, searched the literature, we found out that no one has compared the rectal to the oral modes of a particular drug, and here from there on we proceeded with the investigation. So that if you go back, this is a very broad question. Are antibiotic suppositories better than oral drugs? So which drug are we talking about? What concentration of suppository? In which age group? In which condition? Okay, it's very broad. The next thing is you want to narrow it down. So you do a literature review, discuss with colleagues, establish relationship with senior mentors, and this is the example. After all this exercise, we decided to study it in febrile children. These are your patient population. Which drug, which intervention, rectal as paracetamol, okay, as compared to the C, oral paracetamol. You see, now we are very focusing, zooming, you know, on the particular elements. And what outcome am I supposed to measure? Fever. I would like to measure which one will reduce fever more. So now it's very, very clear. Common problems that we face with research questions are the following, and I'll go over them very quickly. The question may be too vague, too broad, not feasible, too expensive to conduct, not ethical. You will never do that. The team lack the skills to conduct the study, not novel, unlikely to find an effect, etc. So solutions to those problems, let's say if your question is too vague, write it down. Try to become more specific about the participants, the sampling, the variables, the measurement, the difference that you would like to see between the two groups. You calculate your sample size, and some people actually at this stage just construct their tables and for final results. Yani, I'm going to compare, for example, the groups with respect to gender, blood pressure, BMI, etc. So already we're generating the preliminary tables that you see in the study, which means that you're going to put them in your project, in your proposal. Okay? It is very helpful. If the question is too broad, yani it is not feasible, you have to narrow it down. If you're collecting too many variables, yani you need a lot of money and you need a big team, and that is not feasible. Then you try to limit your variables to the necessary ones. Sometimes it is not feasible because you have limited your inclusion criteria. I only want the severe cases of whatever condition, and these are very, very rare. Let's say you want to study children with intracranial hemorrhage secondary to ITP. If you are going to conduct this study, you will never finish it in a lifetime, because ITP in children is very rare. Intracranial hemorrhage is a rare complication in a rare disease. So it's not going to happen, simply. You have to find something else, or maybe expand your inclusion criteria to include all children with ITP. That's one way of doing it. Sometimes you need to eliminate exclusion criteria. Sometimes if you cannot collect all your sample size from one center, you may need to collaborate with other centers, and therefore you increase on your sample size. Or you lengthen the time frame for recruitment, lengthen follow-up period, or maybe rethink your whole study if it is not feasible. If the question is too expensive to do, then you consider less costly study designs. RCTs are very expensive. You may just do it with شو بعرفني, a case control maybe, if the question lends itself to such a study design. You have to rethink your sample size and the amount of data collected, apply for additional financial support, or break the project into different parts. So you do each part separately, and then you proceed from there. And by the way, we do all of this in real life. You are going to face these situations in the future. If you don't have enough skills to conduct your study, let's say you're interested in assessing depression in children who are abused. You are a pediatrician. How can you assess depression? You need a psychiatrist as an expert in your team, as a collaborator, to do the assessment, right? You lack the expertise. If you don't consult the expert, this is not going to happen. Sometimes you need to review the literature for alternative methods in which you have the skills. You can do it using alternative methods. Or sometimes you get the training to do this type of study, or collaborate with investigators who have those skills. If the question is not relevant, not novel, change it. Review the literature again, focus on the knowledge gaps, and remember that the purpose of a research is for you to publish something at the end. So don't even go with, I see lots of research proposals from residents and from attendings, I have to say, ما لهم goal, ما بيعنوا شيء يعني. Just because we're supposed to do this, so okay, what do you want to prove? If it's not novel, حنتعب على الفاضي. The exercise is not fruitful. You will not publish anything. So always remember that your goal is publishing, and therefore it has to be novel. You have to convince the editor that it is worth publishing in his journal. Okay. If the question is unethical, forget about it. It will not happen. So what do? You drop it completely? No. come to the IRB, consult us. We will help you in shaping it to become ethical. So this cannot be done, you remove this, you do this, etc., and you can proceed from there. Sometimes in special cases, you may need to consult a bioethicist for controversial cases, and we have Dr. Arawi who can help you also with this. Maybe you modify your research question or change the protocol. And I want to stress here, and we are going to have a session about IRB because you're going to need it, all, and I underline, research needs the IRB approval. ما في شيء اسمه هيدي chart review أنا I'm doing it only to present in a grand round. This is a systematic investigation, the purpose of which is to disseminate new knowledge. This is research. You need approval, okay? No matter what it is, a survey. Actually, nowadays, sometimes, previously case reports were not considered to be research. Nowadays, there are journals that are requesting informed consent to publish a single case report with IRB approval. So please remember this. Even if you think that your research is in the exempt category, come to the IRB and they will make that determination. وبيقولوا لكم this is exempt and you proceed. Or maybe it is non-human research. I'm working with cells, not even a human being. Well, the IRB is going to give you a letter that states this is non-human research and you are going to use this paper when publishing. When you go online to publish anything, بحط لكم محل ال IRB. Did you get the approval? شو اسم الانستتيوشن, etc. So again, don't make this a hurdle. Have the IRB work with you and you will proceed. You may hear that IRB is a hurdle and a barrier in research. Yes, when you are not doing it properly. But I can tell you, if you do it properly, like you come, you consult, what should I do, what papers are needed, etc., etc. And if you get a response from the IRB, act on it. Don't wait 2-3 months and then come back also missing files or requirements, because then it will go back and forth, and it doesn't happen. People who submit everything from the beginning, including some students at AUB and including some investigators, sometimes they get the IRB approval before they even get the grant, and it has happened many times. I have several projects for myself and for other colleagues who got the IRB approval before they got the fund. So it can happen, but you have to work with that. But if you get a letter from the IRB stating you have to do this, this, and this, and you don't respond quickly or you don't respond completely, it will continue to go back and forth, and it will delay things for you. هلا we are going to practice a little bit, and I will show you how to focus things. Let's say your topic of interest is women's health. You want to narrow it down. You are not going to study everything related to women's health. So you say, okay, I'm going to focus on cancer in women. So that's a narrowed topic. A more focused topic is women smokers and breast cancer. So cancer هلا صار breast cancer, and women now the particular smokers among them. بلشنا step forward. You can now phrase the PICO. You say, my patients are women, the intervention is smoking, and I want to compare them to no smoking, and my outcome is assess whether breast cancer will happen, okay? The next step is women. Which women? At which age? Should I take adolescents? Would they have enough time to develop cancer? Should I take women in their perimenopause, older women, etc.? Okay, so that makes you think, which group am I going to choose from among women? It's very important. If you take adolescent smokers and you want to assess female adolescent smokers for breast cancer, you will have 0 because it needs some time to happen, right? So it's very important to think of that. Smoking, define smoking. Is it cigarette? أرجيلة? How many cigarettes you will consider as smoking? إذا واحد دخن سيجارة بالجمعة, is he a smoker for you? For you as a researcher, you want to include this woman as a smoker or as a non-smoker? So you need to define those. For how long? Would you consider women exposed to passive smoking as smokers? You know, all of these are inclusion criteria. Okay? No smoking, again, define. As I said, somebody who smoked when she was in middle school or in secondary school, and then and college, and then now she's 40 years, she never smoked since for the past 20 years. What do you want to consider her, in the smoker or the non-smoker group? In all of these, again, we're going down, narrowing down on your inclusion and exclusion criteria. Breast cancer, how do you want to catch breast cancer? You want to do mammography, you want to do biopsies, I don't know. So these are all some of the ideas that will come to your mind as you put this PICO together. When do you want to assess them for breast cancer? After how many years of exposure, etc. Let's, I have a bias towards pediatric topics. So computer games, okay? And I will narrow it to violence resulting from computer games. Which participants? Children. Do computer games with violence affect children? So I write down my P, children, and again, now you have to specify the age. Are you talking about toddlers? And you may laugh. Toddlers do spend time watching games. حتى صغار we're seeing 18 months old ليسكتون أهلهم إنه عم ياخذوا الفاكسين بيعطوهم الآيباد أو السيلفون يلعبوا فيه. So define the age group. Watching, the intervention would be watching computer games with violence as opposed to the comparison watching computer games with no violence. Okay? Now, going to the computer games with violence, you have to define how many, the frequency of exposure, the duration of exposure, the violence intensity. يعني إذا دفش واحد بالصورة, do you consider this violence? Okay. What is the outcome you are trying to assess? The effect of the violence. Let's say you decide on aggressive behavior. Does it cause aggressive behavior in children exposed to those games? And then you have to define aggressive behavior. Here is where you need an expert by your side. A psychiatrist maybe, or a psychologist, a pediatric psychologist. And they have to help you to choose which instrument you want to use in order to label a behavior as aggressive versus non-aggressive. And again, a pediatrician cannot do this. I'm sure I cannot do it. And then the T is the time. When do you want to assess this aggressive behavior? Okay, at what time? After a year of exposure, 2 years of exposure? You want to do this at home, at school, etc. Okay? All right, now it's your turn. And I want you to read the title and the objective of this paper. Take a minute and then try to tell me the PICO elements. So it reads, occupational exposure to magnetic fields relative to mortality from brain tumors, updated and revised findings from a study of UK electricity generation and transmission workers. And the objective is to investigate whether the risk of brain tumor is related to occupational exposure to magnetic fields. So what is, who are the patients? Or the participants?
Transmission workers.
Yes, the electricity generation and transmission workers. What is the intervention we're talking about? Magnetic field exposure, as opposed to comparison, no magnetic field exposure, and the outcome is mortality from brain tumors. Okay, the outcome is mortality from brain tumors. Excellent. Let's take another example. Intensive insulin therapy in critically ill patients. Background. You see, هون بالbackground, this is where I told you you have to phrase your question, etc. And sometimes you get to the PICO from there. Hyperglycemia and insulin resistance are common in critically ill patients, even if they have not previously had diabetes. whether the normalization of blood glucose levels with insulin therapy improves the prognosis for such patients is not known. So what are they stating here? The knowledge gap. You see the last sentence? Whether the normalization of blood glucose levels with insulin therapy improves the prognosis for such patients is not known. So who are our patients? Okay, critically ill patients and not diabetic, okay, with hyperglycemia. Okay, so the intervention would be intensive insulin therapy as opposed to okay, and the outcome is whether normalization, actually it could be two outcomes here, normalization of glucose level and maybe morbidity, mortality, whatever, maybe lengths of stay in ICU. That could be one outcome to look at. This is a hard outcome as compared to normalization of blood glucose level. Okay, this is another study to determine the prevalence and impact on mortality of delays in initiation of effective antimicrobial therapy from initial onset of recurrent persistent hypotension of septic shock. Wow, this is difficult even for me. So obviously the outcome is what? Let's start with the outcome. It is mortality. Okay. And the intervention is delayed initiation of antimicrobials as opposed to timely initiation, obviously. Who are the patients? Septic patients, recurrent or persistent septic shock. Okay. This is another example. Effectiveness of hip protectors for preventing hip fractures in elderly people, a systematic review. The objectives to present the updated results of systematic review of the current evidence for the effectiveness of hip protectors from reports of completed randomized trials and to explore the evolution of that evidence. Okay, so what type of publication is this? A systematic review? A secondary publication. Excellent. And what are شو البارتيسيبانتس فيها تبع systematic review? The randomized trials are, the individual studies are the participants of the systematic review, not the individual human beings. Excellent. So what is the objective? The outcome is, sometimes it is, when you read a paper, sometimes it's not easy to start with the P first. You might, find your way as you are reading. So the outcome here is preventing hip fracture. And the P is elderly people, excellent. And the intervention is hip protector as opposed to no protector. Easy? خلصنا. Wow. Any questions? Okay. So for those of you who are supposed to be writing your proposals, I think the best way is, even if you have picked up a topic, to go back home and try now to phrase your research question in the PICO format and rethink what you've already done. If you haven't done it yet, start doing it, okay? Some of you may have started. Rethink again what you have written and see if you can revise to become better. I'm sure now you have a different perspective. Or any questions?
Doctor, how can you make a chart review interesting? Like, this chart review.
It depends on your question. What do you want? What is the purpose of the chart review? And believe me, it can be something very original. Don't do it just because we have to do. Let me يا رب تيجي في عينه يعني بدي شوف شو في اقرا هالشارتات وشوف شو بيطلع معي. No, it starts the opposite. You have something, you have a goal, and to reach that goal you have to do this retrospective chart review. You have to have a question. As I said before, step number 1, define your question. Okay, أعطيك example. We did, I'm sorry, I'm using my research because it comes handy. I'm sure you have noticed, at least in pediatrics, we abuse CRP testing, okay? So, and in different conditions, we abuse it for diagnosis, for treatment, follow-up, prognosis, etc. So, my question was, أول شيء, is there evidence to what we are doing? In which condition? Is it helpful for diagnosis or is it helpful for prognosis? And how much are we spending? So that was my question. And therefore, I put together this chart review and it's now published. But it started with a real question. I didn't go just, you know, اقرا كل الشارتات شوف شو بيطلع معي وفكر بعدين شو بدي أعمل. You don't do this. بعكسها. And again, go talk to your mentors. شوفوا. But if you already know what is your area of interest as a specialty, that's a start for you. إذا حدا بدكم يعمل gastroenterology, maybe you should go to a gastroenterologist. حدا بحب يعمل intensive care, go to your intensivist. حدا بحب يعمل endocrine, go to an endocrinologist. GP كمان, go to family medicine, internist, pediatrician, you know. This is how you start with something. All right, see you next Wednesday, inshallah. I think our next session is, Rola, next session is about IRB. Okay.